Good afternoon and welcome to our Brown Bag Lunch today. Just to remind those of you who are here for the first time or tuning in for the first time remotely that this is about a monthly series that we have on public health topics. And today we are focusing on a nursing topic and we've synced this up with Nursing Week. So this is going to be a great presentation on public health nursing here at Public Health. With the brown bags, if you guys have ideas for other brown bags, Matias Valenzuela and Gloria Nalbeta and I are the conveners of those topics, so please let us know if you have any good thoughts for us, and I'm going to go ahead and send this over to David.
Thank you. If you're wondering why the microphone isn't working, it's because it's not working in this room. This is just for the video. So can you hear me in the back okay? Great. Hey, welcome everybody. I've been really looking forward to this session today. I'm going to be eating my lunch in the back, but I just wanted to start off by acknowledging that we're here today because it is Nurses Week. I mean, every day is Nurses Day, but this is the official Nurses Week. I have a proclamation that Betty and I are going to read in just a moment, but I was thinking, walking down to this meeting, how when I was in medical school and in residency, obviously, worked closely with nurses, but it was part of a larger team. There were lots of other interns and residents. There were medical technologists. There was a whole group of people. And it really wasn't until I finished residency that I realized how valuable nurses were and how basically they had taught me most everything important that I know. And in particular, what happened in my life was that when I finished residency, I knew I wanted to do a career in public health, but I wanted to get just a little bit of clinical experience. And so I was in Oregon, the state of Oregon at the time, and there was a tiny little town on the southwest Oregon coast called Gold Beach. I don't know if any of you have ever been there. It's where the Rogue River flows into the Pacific Ocean. Pretty town. It also happened to have a old-fashioned community hospital. Don't think it's still there anymore, but it was really the only hospital until you went down south of the Oregon border into California on the southern side, and you had to go all the way north to Coos Bay on the northern side. So it was very, very remote. And the situation they had there was a couple of not very nice practicing GPs in town who did not want to see people who did not have insurance. And they literally had, as I was finishing up my residency, an incident where a woman who did not have insurance came to the hospital in labor because she was going to deliver, and they would not, none of the doctors in town would come in to deliver her. So the 3 nurses that worked at the hospital actually were not allowed to admit her and had to go out onto the stairs, literally, of the hospital and deliver her on the stairs of the hospital. And the community thought this was ridiculous, and so they decided to hire a physician, me, to come down and work part-time at the hospital on behalf of the hospital so they would never get into that situation again. The reason I'm telling you this is because I went down there fresh out of residency. I knew a few things, most things I did not know. And the hospital, and I had 96-hour shifts where I basically live in the hospital for 4 days. And so got to know those 3 nurses that really ran the hospital incredibly well during that time. And it was just, when I think about all my experiences in clinical care, working at that hospital rises to the top of the list because it was a great place to work, and it was a great place to work because I actually got an opportunity to work in partnership with these 3 nurses, get to know them over a period of time, realize the strength they brought to the community, and the reason I'm telling you this story is it turns out those nurses were also the same nurses that ran the local health department. And so that was my experience to public health nursing as well. So fast forward to today, and we are in a world where increasingly the value of nurses and public health nurses are being recognized by more and more people. But I'm here to tell you I've known it for at least the last 30 years. And in recognition of that, I'm going to have Betty come up. We have a proclamation for today. And proclamations, because they have a lot of whereases, work better if 2 people do them. So I'm going to start off, and we're going to do a tag team of whereases. So this is a proclamation by Dow Constantine, starting off, whereas nurses in the United States comprise our nation's largest healthcare profession,
And whereas the depth and breadth of the nursing profession meets the different and emerging healthcare needs of our population in a wide range of settings, and
Whereas a renewed emphasis on primary and preventive health care will require the better utilization of all of our nursing resources. And
whereas professional nursing has been demonstrated to be an indispensable component in the safety and quality of care of hospitalized patients. And can I say of people in the community?
you can.
Thank you. And people in the community. And
Whereas cost-effective, safe, and quality healthcare services provided by nurses will be an ever more important component of the healthcare delivery system in the future. And
whereas the American Nurses Association has declared the week of May 6 to 12 as National Nurses Week with the theme Nurses Advocating, Leading, Caring, in celebration of the ways in which nurses strive to provide safe and high-quality patient care and service to the populations in the community, and to map out the way to improve our healthcare system.
now, I'm not Dow Constantine, but I'm going to read this. Now, therefore, I, Dow Constantine, Executive of King County, do hereby proclaim May 6th to May 12th, 2012 to be Nurses Week in King County, and encourage all citizens to join me in honoring the nurses who care for all of us, not just this week, but at every opportunity throughout the year. Yay! So I'm going to set this up here so people can check it out later. And thank you very much. I'm now going to turn this over, I think, to Doreen. Here you go.
Hello, everyone. I'm Doreen Hirsch, the Interim Chief of Nursing. For those of you who don't know me, welcome. I have the pleasure of introducing Betty Beckmeyer, who is our next speaker, and her resume is so impressive I want to read it all to you. Many of you know her, but you might not know this. Betty Beckmeyer, PhD, MPH, FAAN, is an assistant professor at the University of Washington School of Nursing, an adjunct assistant professor at the UW School of Public Health. Her focus is on public health systems research, particularly as it pertains to the practices of state and local health departments in relation to reducing health disparities. From 2001 through 2007, Betty served as Deputy Director of the Robert Wood Johnson Foundation's Turning Point National Program Office, working with local and state health department colleagues and partners across the country to transform their health infrastructure. Prior to coming to the UW, the majority of Betty's career was in local public health practice, where she worked in a variety of positions in management evaluation as an epidemiologist and as a frontline public health nurse with us. Betty has also served in significant leadership positions within the American Public Health Association and the Washington State Public Health Association. Betty is an RWJF Nurse Faculty Scholar and is also an active member of the Washington State Public Health Practice-Based Research Network, the PBRN, and its executive committee as well with the National Network of PBRNs. She is the PI on several PBRN-related research projects, in particular the Public Health Activities and Services Tracking, or FAST, study. FAST is an ongoing multi-state PBRN study to examine the health outcomes associated with variation and change in local public health service delivery. I present Betty Beckmeyer.
But I know a lot of you are saying, yeah, but we know the real Betty. So just keep that under your hats for those of you who don't really know me. But I want to talk, I'll speed through here today because I know I don't have much time. Okay, that'll be great. So folks wanted me to talk a little bit about our powerful nursing history. So I'm going to talk about that and bring that to where we really talk about what this means for us in terms of reducing health disparities, because that's been a big focus of mine, and how I would contend that's a big part of our job, an important piece of our job, and getting upstream to better being able to do this. So to begin with, we really stand on the shoulders of giant nurse advocates before us, and I was glad that Dow Constantine talked about us being nurse advocates. And they beckon us to address and respond to today's emerging health issues and persistent disparities in uncertain environments. And I would say in this uncertain environments, this responsibility to use this professional power of ours and the depth of our understanding in communities is even greater. And I'll talk a little bit about this in terms of our obligation to this work. Next slide. So to get there, we'll talk about these powerful nursing champions, health disparities, and getting upstream. So these powerful champions, I'm a bit of a, some of you guys know, I'm a bit of a public health nursing history buff, and I've had a little bit of a love fest with some of these folks. But for me, it's not just because of what they did so long ago, but it's what they did that can inspire us to do some of the same today, and I would contend a lot more. We can do a lot more than they did years ago. So for some of you who don't know some of these people, on the far bottom right here is Lavinia Dock. Lavinia Dock was this amazing turn-of-the-century woman in New York City, and she was a big suffragist and a political activist. She fought for opportunities for women to have power and influence in pushing social and progressive reforms and on children's issues and women's issues, because she really didn't think that men would vote in favor of things like that anyway. So women really needed the power of the vote to be able to move things on these issues. She saw this really clear connection for her between a vote and voice and nursing and health. So way back then, at the turn of the last century, she was right there. Mabel Stoppers in the middle, on the bottom, was a TB nurse. She developed and coordinated a wide range of services that improved the health of citizens in Harlem, as an example. She also kind of led the movement in World War II to gain full integration of African American nurses into the U.S. military and into professional nursing organizations, et cetera. And then there's my favorite, Lillian Wald, up in the far right-hand corner. And she was a visiting nurse in the Lower East Side of Manhattan, and a community activist, and a fundraiser, an administrator, a policy maker, et cetera. She started the Henry Street Settlement House, of course. She's considered our first public health nurse, but some of you may not know, she helped start the Federal Children's Bureau. She worked with W.E.B. Du Bois and others to start the NAACP. She was a very powerful activist. And these women in particular at this time and for these early decades of the 20th century were widely seen too as the elite of nursing. They were the most educated among nurses. They had this very independent practice. In their scope of work, they really did not have any relationship with physicians, as an example. Their relationship was with communities and with policymakers as well, directly. They were viewed as community partners and as advocates. Yes? Someone's calling me.
Could you mute your phones, please?
Someone's calling me. It's Lillian. No. But these women applied their indignation from what they saw on a day-to-day basis and from what you see very often in your work. Institutionalized poverty among gender and ethnic and racial inequalities that influenced health, that were influenced by health policy. And they acted on these things. And they did that without having the vote. They weren't able to vote. They didn't have anywhere near the education we've got in this room. They didn't have consistent support from men. They didn't have hard data to support their beliefs like we do now. They didn't have good communication. They wrote these long, beautiful, long-handed letters. They didn't have, Twitter and emails and websites and all that kind of thing. But so to me, this helps me imagine what our own future as public health nurses and as advocates really could be. Next slide. So these women kind of figuratively stood at the headwaters. You guys know the analogy about upstream, downstream? So they stood in this stream analogy. They stood at the headwaters, looking downstream. And they saw early on in the river's formation what they could focus on in terms of the maintenance of health and equitable distribution of its benefits. They focused on what could be different, and they acted on making change. So they thought big. Lillian Wald even went and talked with President Wilson and said to talked to President Wilson about how war would probably be bad for people's health in terms of getting out of or not going into World War I. And again, they did this all without being able to vote and a lot of other things. They acted on these social conditions, these underlying causes of social injustices. But these public health nurses didn't thrive this way forever. Unfortunately, these early pioneers, they stood at these headwaters, and a number of forces kind of drew them downstream, and this slide kind of touches on some of them. And kind of medical dominance sort of took over a lot of the nursing profession, not just public health nurses too, but also the larger nursing profession. As we sort of conquered, and I say in quotes conquered because we all know we didn't really conquer infectious disease, but we got a major handle on infectious disease back then. And so chronic disease kind of came more into the forefront. Hospitals became the big place for people with chronic disease, and they had lots of gadgets and technology, and they were drawing people into hospitals. So hospitals kind of became big business. And some of our community settings became a lot less a lot less well-funded. Private funding was hard to come by. And nurses became less independent. We became more of nurturers. We emphasized more the nurturing part and less the activism part, less the advocacy part of our profession. Next slide. So as a profession, we got more downstream. And Melanie Dreher, who's this fabulous scholar, talks about how we went from thinking big to thinking small and more of these short-term solutions. And this was a lot of the nursing profession, but also public health nurses as well. But my point here is to acknowledge that we do a lot of work downstream, and it is good work, but it's often more exciting. Things happen more quickly. We get more done. And I like the downstream analogy too, because I'm a bit of a skier and a whitewater kayaker, and so I can get that, that's fun. But downstream practice alone doesn't work as well. We've all done good work. We all do good work and believe in what we do, or we wouldn't be so passionate about it. But this upstream work takes a long time, and it's often much more complex. So especially with these vulnerable populations that we work with and the ones we want most to support. So we've got these guidelines that we're supposed to meet, and even though Lillian Wald and her sisters, and not many brothers, sorry, mostly sisters at that time, they knew about health disparities, but it really wasn't until our professional lifetimes, many of us in this room, that we even really set health disparities goals to be reducing health disparities. So it was in 1979 we first came up with the first document that later became the Healthy People documents. And in that first one we didn't even talk about health disparities. It wasn't until 1991 when the first Healthy People document was released. That was Healthy People 2000, when they made health disparities one of the goals, that we should be trying to reduce these. But these health disparities persist, and some are even widening, and you guys see that in some of your work today. And these measurements, there's a lot of research out there that says, these things are widening, and this woman, Jennifer Orsi, has done some really good work in this area, but the data she was looking at were when times were good. You remember when the good days of up till about 2006 or so, when we didn't really know it was good, but maybe it was. And so disparities were widening then. So we've got a lot of work to do. But clearly, our well-intentioned efforts are good, but they're not getting us there. We require more and more just solutions to our practice as public health nurses. But in talking about these issues related to disparities, you guys see these cumulative effects of health disparities every day, these ongoing inequalities. So they are our problem as nurses. National nursing documents, however, say that this is our job. This is what we're supposed to be doing, which I like to always remind myself and ourselves and students that these national nursing documents drive and guide our practice to do more than just suggest that we have a role to play. It says that we need to be leaders in this work. These documents indicate that social justice is an essential feature of our profession. And so as nurses invested in equity and human health, we should be asking ourselves if our practice is adequately upstream. Are we adequately addressing these? Are we doing this fast enough and profoundly enough? What should our practice be? And in these uncertain environments, this is perhaps as good a time as any to be really looking at this, because things are really in a certain amount of upheaval with things such as, even going back to 10 years ago with September 11 and anthrax and bioterrorism and preparedness and all of that. Now we're talking about obesity in ways we didn't talk about a decade ago. SARS, H1N1, climate change, and then of course this little thing called our financial crisis, right? So there's studies out there, and as if we needed studies to really tell us that financial problems are bad for people's health, right? Especially for the health of our vulnerable populations. But these studies are pretty interesting, though, because they compare countries in financial crises, and they've compared municipal health departments, et cetera. And what's particularly interesting and hopeful to me is that they differ when undergoing some of the same stressors, system-level stressors. And what appears to be the difference is policy differences and approaches to health, and some of these kinds of things that we actually have. They are modifiable, things that we can act on, things that we can be a part of changing, and things that are part of our roles as nurses. So which gets us to getting it back upstream, and I say back because we've been there. We have been there as a profession. So I don't know that we need to reinvent a lot of this. This is part of who we are and what we do. We can go there. Even if you're a whitewater kayaker, you can actually paddle upstream. So it is possible. All these things are possible. And we increasingly have tools for making this happen. So we have these supporting documents that say this is what we do, this is who we are, and we are supposed to be doing this work. We have collective numbers. Think of how many people are in this room and how many are online or listening in just here in King County and the Washington State Nurses Association and these larger collective groups of ours. So we have ways to communicate that are a lot better than writing little long-handed letters to one another and say, hey, this is important. Also, we have this community knowledge that we've always had. These are things we've always had in our toolbox, and respect of our communities. And precedent. Our foremothers did this work and laid this groundwork for us. So in that vein, as nurses, public health nurses in particular, this is our job, to be changing these conditions in which people can be healthy, all people. And how to do this? I would say we're obliged to act on these injustices of health disparities and inequities. So, and we can and should act on them. We should not only just be a part of it, but we can be leaders in some of this change and think and act upstream. So we're here today, for example, to really advance nursing leadership and our skills and our collective power around some of this kind of thing. And you all have this very powerful, privileged insider's view in the day-to-day work you do. So what do you do with that? What do you do with that view? And we have these numbers, the numbers of us as nurses, and offer up this incredibly underutilized potential that we have to act on change. We could be reading about this from the literature. I've got a little reference list at the end you can all dig into later. And write about and speak about this from your own local data, your own local knowledge of your communities. There's other of us that are doing the research, but that takes time, and we could all wait around till we finally kind of come up with our fancy pants research. But in the meantime, you guys have a lot of knowledge right here, right now about how these issues impact your communities you see. And you have the stories to tell. You can inform your understanding from your best available evidence and rich information about your own practice. There's also, I throw in collaborating with your academic colleagues, just because, you know, that makes things fun for me. But thinking about, too, our practice, does our practice reflect this? Are we, do our education leadership support this? Are we acting on these social conditions? Is our practice socially just? We can always be asking these things of ourselves and looking at how we're going to do it differently. So Lillian would say, the call of the nurse is not only for the bedside care of the sick, to help in seeking out the deep-lying basic causes of illness and misery, that in the future there may be less sickness to nurse and cure. And I would leave that if our foremothers could make such dramatic change and be so well regarded and well remembered, and they couldn't even vote, imagine what we can do as we sort of gather together and address these disparities. That's it. Thank you. I'm stuck.
Yes, we're doing the video. When Kate Racy, Donna Borg for Purnell, and I had the idea to put on this brown bag, we really talked about ways that we could best portray the work done by public health nurses in public health. We had originally settled on a panel, but we think that this will be a much better format using a film to portray the depth of nursing practice in public health.
Doreen, would you tell the people on the... What does it mean to be a nurse in public health? That probably depends on who you ask, because nurses play many different roles, a few of which may surprise you. Here are some responses to that question from nurses who work for Public Health, Seattle and King County.
Hello, my name is Shannon Rosema Goldstein, and I'm a nurse and an educator. My work is as clinical staff development and training specialist for the King County jails. My role is to provide education and orientation support to the nurses and physicians who work in the King County Jail. So while I don't work directly with the inmates, I offer support and tools to the nurses and physicians so that they can provide the best care possible to our patients who are incredibly complex. I love my work because it is challenging, it is interesting, and no 2 days are ever the same when you work in the jail. I am a nurse in public health.
Hi, my name is Donna Alice, and I'm a Health Services Administrator in the Prevention Division of Public Health, Seattle and King County. I support 5 different programs that address chronic diseases and injury prevention. When I became a nurse, I knew I wanted to work to help make people have safe and healthy environments, and I'm doing exactly that. I do this because I believe in the importance of prevention. I am a nurse in public health.
I'm Patty Hayes, the Director of the Community Health Services Division at Public Health Seattle King County. I get the honor of working with all the great programs in this division that include maternity support services, healthcare for the homeless, school-based health centers, child care, WIC. It's just fabulous, and it's been a fabulous career as I bring leadership and specialization in public policy development to public health. I have loved this work and love all the folks that I work with to help families navigate and find their best health for their families. I am a nurse in public health.
Hi, my name is Trina. I work with Child Protective Services. My job is to join with families and to try to stop the cycle of abuse, to plant seeds of hope. It is an honor, a privilege, to be able to partner with families in such a critical time in their lives. I do this because I'm called to do this. I am a nurse in public health.
Hi, my name is Lois Shipper, and I am the Parent-Child Health Program Manager for Public Health Seattle and King County. In my job, I help to develop and coordinate services for pregnant women and families with young children. And part of how I do my work is to identify, develop, and emerge new and best practices to support our care so that we're doing the best job possible in the most coordinated way as we provide services. And I do it because I believe every pregnant woman, every infant, every child, every family deserves the best support we can give them to have the happiest and healthiest life possible. And I am a nurse in public health.
My name is Cynthia, and I'm a jail health RN. My job is to screen inmates for medical and psychiatric conditions when they arrive to the jail. I initiate treatments based on their health history, obtain orders for medications, make initial appointments and referrals to medical and psychiatric providers, and request appropriate housing. I administer medications throughout the day, provide wound care, check vital signs, perform diabetic checks, and conduct many other nursing assessments and treatments. What I like most about this job is the exposure to a wide array of medical and psychiatric conditions in a mixed setting of primary and urgent care. I am a nurse in public health.
Hi, I'm Robin Lawrence. I'm a nurse and I recently worked with the Mobile Medical Program. The Mobile Medical Van visits sites around South King County and offers services to people who are in a homeless situation. The team on the mobile van helps people with a range of needs from housing to medical and mental health care. What I like most about my work with the medical van, being part of a talented and caring team with the ability and resources to really have an impact on people's lives. It's an honor to work with people in such a respectful way. I am a nurse in public health.
Hi, my name is Della, and I'm the nursing supervisor for the Moms Plus program. Moms Plus is a nursing program that supports substance-using pregnant and parenting women. My role is to support the nurses providing the direct service to these women. Most of my time is spent case conferencing with my staff and planning care for our clients. I do a lot of coaching for my nurses to help get our clients moved from using to treatment and helping with their sobriety. The client is the center of what we do in Moms Plus. This is why I do what I do. I am a nurse at Public Health.
Hi, my name is Rebecca Shirley. I am an occupational health nurse specialist. I work with employees, volunteers, and interns. My role is to support our workforce and ensure as safe a workplace as possible. I am usually found helping workforce members with immunizations or lab work to make sure that they are protected from communicable diseases. Or I also am often found fit testing our workforce members for respirators, and that's in order to protect them from airborne diseases that they could be exposed to. Or I'm also often will assist our workforce members when unfortunately an exposure may have occurred. What I like most about this job is the satisfaction that I get every day from helping important people do really important work. I am a nurse in public health.
Hi, I'm Chris Hoyle. I'm a doctorally prepared family nurse practitioner. I see patients in the clinic. I diagnose and treat and prescribe as needed. I help them to learn to manage their health conditions. By doing this, I hope to make a difference in the health status of the larger population. I am a nurse in public health.
Hi, my name is Betsy Hubbard. I'm an RN and immunization practice manager in communicable disease epidemiology and immunization section. I work with the public and private healthcare providers in King County to assure they understand how to store, handle, and administer vaccines to children and adults in their practice. I do this by answering their phone calls and emails, and I conduct quality assurance site visits to document their immunization practices. I love being able to make a sometimes complicated subject easier for them to understand and to give parents the information they need to help them decide whether or not to vaccinate their child. I am a nurse in public health.
My name is Lindsay Bracken, and I'm a licensed practical nurse at the King County Correctional Facility. There are 10 LPNs that work day and evening shifts at the King County Correctional Facility. We are responsible for assisting the medical providers in a clinical setting. This includes vital signs, passing and verifying medications, lab collection and processing, EKGs, wound care, patient teaching and education, responding to emergency situations, and maintaining our Department of Health lab certification. We work with a very diverse and oftentimes at-risk patient population. What I enjoy the most about my job is the wonderful diversity amongst my coworkers and the fact that this is a fascinating and rewarding work environment. I am a nurse in public health.
My name is Tai. I am a registered nurse at Downtown Public Health. I oversee 3 clinics, including family health, travel medicine, and refugee screening. I love working at King County Department because I enjoy working with people and making our community healthy and happy. I am a nurse in public health.
Hi, I'm Mary Fatika, the nurse recruiter. I have an amazing job. I get to meet hundreds of nurses every year. They are all trying to find the job that will inspire them. Each nurse that comes to me has knowledge, skills, abilities, and experiences to be considered when making a job placement. I will describe a job to them that sounds like a good match, and suddenly they light up and want to know more about the job and pursue working in public health. When we are doing the job that answers our calling, we are doing our best work. We are making a difference in the lives of those at most risk in King County. I am a nurse in public health.
Hello, I am Deborah Greenleaf. What I have so appreciated working as a nurse in public health is our ability to practice within a holistic framework, one which identifies and responds to the factors that affect the health and well-being of all we serve. Whether I'm speaking with a parent, a child protective services social worker, a child, a legislator, a domestic violence advocate, a judge, a law enforcement officer, or a public health nurse, I have had a unique opportunity to address and integrate our differences and our commonalities. And every day I am surrounded by our dedicated, hardworking, and compassionate colleagues who come together and touch so many people's lives today and well into the future. I can't imagine a better place to have such an amazing career. I am a nurse in public health.
Hi, I'm Julie Parker, and I'm a public health nurse in the Child Care Health Program. Child Care Health nurse consultants work in a multidisciplinary team with registered dietitians and a child psychologist in order to improve health and safety in early learning and school-age programs. We work collaboratively with community partners such as Department of Health, Department of Early Learning, University of Washington, and many more in order to develop policies that support healthy child care programs in the children and families that they serve. And we also respond to emerging public health concerns relevant to the early learning community through education and outreach, such as H1N1, emergency preparedness, obesity prevention, environmental hazards, and more. I'm a nurse in public health.
My name is Cindy Minneke. I'm a family nurse practitioner, and I am a nurse in public health. As a family nurse practitioner, I care for patients here at the Downtown Public Health that have various health concerns like diabetes, high blood pressure, depression, asthma. In addition, I do health screenings, well women exams, well child exams, and health promotion. I love helping people manage their own health. I am a nurse in public health.
Hi, I'm Sean Dumas. I'm a nursing supervisor in the King County Jail. I work with at-risk and underserved populations. I help ensure safe and high-quality health services. I do this because all people in King County deserve high-quality healthcare services. I'm a nurse in public health.
Hi, my name is David Reyes, and I'm a Health Services Administrator with Public Health Seattle-King County. I wear many hats, and one of those is also the chair of the Public Health Nursing Section of the American Public Health Association. I assure access to quality public health services for all our vulnerable populations, and to advocate for resources to improve our health services and our health systems. As chair of the Public Health Nursing Section, I advocate for health equity and to improve the health of all our populations, especially the most vulnerable. I do this because I believe in the importance of making a difference to improve the lives of families and communities across our nation. I am a nurse in public health.
My name is Darla Moss. I'm a public health nurse in the Pathways Home program. I work with families that have a child or children under the age of 18. I work with these families, providing support and linkage into needed services to help them overcome the barriers they have to obtaining and remaining in permanent housing. I am a nurse in public health.
I'm Donna Borgford Parnell, and I'm an advanced practice nurse specialist here at Public Health Seattle and King County, where I've worked for the past 25 years. My main role is as the Children with Special Health Care Needs Program Coordinator. I work with an amazing group of public health nurses, physicians, clinics, health plans, hospitals, schools, and community and local and state governmental agencies. Our goal is to assure that services are in place to help these children have the opportunity for the healthiest life possible and to develop to their fullest potential. I love to be working in a program that not only helps individual children and their families who are experiencing overwhelming life circumstances, but also to improve the system of care for those families and to the community. Another one of my roles is as the chair of the Staff Nursing Local Unit. I feel honored to be representing such a skilled group of dedicated nurses. We work together to bring forward issues that nurses identify that will improve their working environment and the quality of nursing services to all the citizens of our county. I am a nurse in public health.
Hi, my name is Diana Vergis Venn, and I work with underserved groups in Southeast Seattle on creating and supporting something that we're calling natural food hubs. These are places to build community through growing, sharing, and cooking great food. I do this work to address the upstream causes of chronic diseases and depression. What I like most about this work is how engaged people are in these programs. We like to call it stealth health because populations are getting healthier without even completely being aware of the change in behaviors that are occurring. I am a nurse in public health.
Hi, my name is Karen. I'm a public health nurse with the Nurse Family Partnership Program. We work with young mothers and their babies. We impact moms and babies' lives throughout their lifespan.
We are nurses in public health.
My name is Eileen, and I'm part of the Communicable Disease Epidemiology team. When we get a report about an infectious disease, we follow up with individuals and families. We educate community members, providers, and organizations about how to limit the spread of disease. We do this to promote and protect the health of our community.
We are nurses in public health.
I'm Heather Barr, an RN public health nurse. I work with people who are homeless and people who serve people who are homeless. I assure that agencies have policies that protect the health of people who are homeless and the people who work with them. I do a lot of teaching about germs and how to avoid contact with germs, and I enjoy doing that. I love the people that I work with, both the homeless people and the people who work with them, and I believe they all have a right to basic safety and health, where they work and where they sleep and eat. I am a nurse in public health.
Hi, my name's Kate Besh, and I'm a Children with Special Healthcare Needs public health nurse. I work primarily with premature babies and other children who have spent a lot of time in NICUs, or neonatal intensive care units. My job is to support families adjusting to special needs children, with the ultimate outcome of optimal health and development. I've also built relationships with hospital NICUs in the area so that I can work with families prior to discharge and assist in their preparing for the child to come home and their transition out of the hospital into the home environment. What I like most about my job is the privilege of working with my families to help them adjust to life with a special needs child. I am a nurse in public health.
Hi, my name is Drusilla Van Avermaet. I am a personal health services supervisor over a primary care and family planning clinic. The main role of my job is to support the primary care and family planning staff to provide quality health care for the low income and the uninsured members of our community. I like my work because I get a real thrill out of knowing people are well cared for and seeing their lives change for the better, and that's both staff and patients. I am a nurse in public health.
My name is Carol. I manage the primary care program at Public Health. I see my role as supporting the clinical teams who take care of the people who receive services in our primary care clinics. I try to support these physicians, nurse practitioners, RNs, and MAs with programmatic tools, advocating for the program, and helping them in their quality improvement efforts to better serve our clients. What I like about this is I get to work on a systems level in healthcare. I am a nurse at Public Health.
Hi, my name is Lauren Greenfield, and I am an immunization promotion manager in the Communicable Disease Epidemiology and Immunization section for Public Health. My job in working with the public is to educate communities and to raise awareness about the importance of immunizations and to inform communities about the risks of vaccine-preventable diseases. In my work with healthcare providers, I'm usually offering clinical guidance about vaccine recommendations, which have become very complicated over the past few years. I do a lot of writing of educational materials for both general public and healthcare providers, and a lot of talking in person and on the phone with both audiences. What I like most about my work is I'm very passionate about the value of vaccination and the ability of vaccines to protect people from very serious diseases. By promoting immunizations, we can promote the health and well-being of our communities. I am a nurse in public health.
Hi, my name is Marla, and I'm a public health nurse. As a field nurse, I visit families and caregivers of young children in their homes, most often families with parenting challenges. I do assessment and evaluation of health and safety, and also work with them to promote and improve basic parenting capacities. One of the reasons I like my job is that I'm able to practice primary prevention, which simply makes sense to me, and which in the end can make a positive long-term difference in our communities. I am a nurse in public health.
Hi, my name is Carson. I'm a public health nurse and I work with male and female clients. Usually I'm helping link them to services and making referrals to medical care and community resources. My job is to assess and educate about family planning, pregnancy, hypertension, diabetes, and many other acute and chronic illnesses. I do this because the people that I work with usually don't have the ability to manage their own health care, and they need an advocate in this system to help navigate these complex systems. I do this because I know I make a difference in people's lives. I am a nurse in public health.
Hi, my name is Kim Wong. I am a public health nurse. I work with patients who have tuberculosis. Tuberculosis is a contagious disease. In order to interrupt the transmission of TB is to protect others. My job is to make sure patients get treatment as soon as they are diagnosed. I work with patients to ensure they complete therapy. I enjoy my job because it allows me to help patients to obtain treatment so that they will be able to lead a normal life. Here is who I am, a nurse in public health.
My name is Gail Piper. I'm a public health nurse and work with low-income, culturally diverse, pregnant women and women with children under 1 year of age. I help them have a healthy pregnancy and for babies to be born healthy. I do a lot of listening, assessing, encouraging, mentoring, educating, evaluating, comforting. I do this because it's my calling. I am a nurse in public health.
Hi, I'm Chris Edwards, and I'm the clinical coordinator for the Breast, Cervical, and Colon Health Program. I work with limited income, uninsured women to help them access breast, cervical, and colon health screenings, and with men to help them get colon health screenings. I spend most of my time helping women who are diagnosed with breast or cervical cancer to get cancer treatment. I also work with clinics to streamline services for all of our clients. Our program reaches clients who might not access the healthcare system. I feel privileged to do this work because we help people get important screenings so that cancers can be diagnosed at earlier stages when they are most treatable. Our program saves lives. I am a nurse in public health.
Hi, my name is Doreen Hirsch, and I'm the Interim Chief of Nursing. It's my job to support all of these amazing nurses from whom you've just heard, as well as many others who work hard to provide quality nursing care for our community. As you can see, being a nurse in public health takes many, many shapes. I want to thank all of the nurses who contributed to this video. These committed people make a difference every day, and I'm privileged to have the opportunity to work with them. I, too, am a nurse in public health.
To close out our program, I want to introduce Heather Elsa. One thing that I heard loud and clear through this film was that the nurses who make a difference, and I think that hearing from Heather will let you know that she agrees.
I'm truly honored to be able to speak about the important work that all of you do and how it has personally impacted my family. I would like to say thank you to Nurse Kate Besh, our babies say hello, and Doreen Hirsch for allowing me to speak today. And I would also like to personally thank Coordinator Donna, who donated a few extra cans of formula to me, delivered in a clandestine meeting outside the Seattle Public Library in a conspicuous bag, making the whole transaction appear to all people like a drug deal in progress. It's humbling to speak before nurses when I consider all the difficult emotional and physical work that you do every day and how many people you help through your careers. I want you to know that I'm not someone who asks for help easily. When I'm in trouble, I want to bunker down by myself and not involve others in my difficulties. My experience is indicative of many others who find themselves in a moment of crisis and to receive critical care from people like you sitting here today. I am a twin who had a set of twins. My husband's father is a twin who had a set of twins, and his twin brother had a set of twins. Still, I was shocked when I found I was having a rare form of identical twins without fertility help at the age of 40. I was warned from the beginning that the pregnancy was very high risk, but when I started going into labor at 16 weeks, my husband and I really had to consider whether our boys would even make it. I was hospitalized on bed rest for weeks, out of work. When Milo and Fritz, my boys, were born, they seemed fine, but just one day later, Fritz went into respiratory failure and teetered upon death. In the end, Milo was in the NICU for 2 months and Fritz for 3. We had exhausted all of our savings, sick leave, vacation time, and maternity leave before our babies had even been born. As a middle-class working family, my husband and I had always been self-sufficient and comfortable. We had 2 incomes and lived comfortably. After the birth of our twins, whose medical bills ultimately totaled more than $3 million, we suddenly found ourselves thousands of dollars in debt, no savings, and no income for months. No one could tell us if our babies would survive, and we had no information about when we could return to work. And how could I return to work when every day there were 2 of my babies lying in the hospital without me? When a hospital director told us that we may qualify for Medicaid, I had no idea what Medicaid even was, and I was sure we would not qualify for it. I filled out the paperwork, but with low expectations. I felt there would be no help for people like us who had good incomes before our pregnancy. Fritz finally came home with a feeding tube requiring special care. How could I go back to work with a baby needing this much help? On top of everything else, I had complications from labor, which not only required surgery, but which destroyed my breast milk production. I would need to buy formula. I had never even bought a can of formula in my life before, and I had no idea how much it cost. When I realized that formula was going to cost us $400 a month, I realized I needed to go back to work just to make money to buy formula. But how could I do that? I was a walking emotional and physical zombie. My heart was broken and my will was diminished, and I knew that not one of my friends or family could understand what we were going through. Then I received a phone call in the middle of a horrific day from Nurse Kate. I admit I was completely skeptical. I was damaged from too many doctors and appointments and bills. I was hardened and protective of my family and our future. And I couldn't take another 4-hour doctor appointment that required me to miss work again. I was on medical appointment overload. I just wanted one person to tell us that our babies were going to be okay, that they didn't need another test or were at risk for yet another condition, that we would be okay and that we were doing the right things. Kate sensed my fear immediately, and she talked me down by telling me that she would come to me and before work, so I didn't need to figure out how to get more time off of work. She also told me that she could deliver WIC checks to me every month that would pay for my baby's formula and basic food. I almost couldn't believe it. What's the catch, I thought. Sure enough, Kate arrived early one morning with her baby scale and her no-nonsense positivity. She was calm, informational, flexible in her suggestions, and considered us and our babies as we were, not as information on a chart. She had answers for everything: medical contacts, nutritional help, developmental goals, behavioral suggestions. I can truly say that she changed the outcome of our baby's health. She gave us comfort, she gave us confidence as first-time parents, and she made us feel that we could get through the marathon that we had in front of us. And she gave us very honest feedback about our baby's health in a way that balanced the negatives and the positives. She never made me feel ashamed to ask for help or made me feel helpless. I felt stronger and more capable. Look at you. I want you to know that we thought Nurse Kate was our nurse alone. Little did we know she gets around. When we visited our friends who had twins in the NICU at the same time as ours, they said, "Nurse Kate? Oh yeah, we had her too. Don't you know she's famous?" The last visit Kate made to us, I cried. She said, "I'll come back anytime if you need me. I know that this is not just a job. It's in her deepest inclination to help others. It's a true devotion to babies and to parents." This is where I get political. This is what I politically and personally consider true family values. We could have gone into bankruptcy and lost our insurance and been on our own. But would we have been on our own? Someone would have paid the $3+ million in medical care for our boys, and it wouldn't have been my insurance company that I'd been paying into for my whole career. The fact that our government helps people of all incomes in their times of need by bringing in nurses to help the most vulnerable, this is what I want my tax dollars and my country to be committed to. This is the safety net that we should all have if we find ourselves in a moment of need. This is why I wanted to come here and tell all of you that the work you do has real outcomes. Our family is just one. It can be measured in better health for babies and resources for parents and happier families with less stress in their lives. And it can also be measured in a purely cost-benefit analysis. What you do is not simply now, today, or here. What you do every day lasts lifetimes and generations. The care, comfort, and knowledge that you give parents will be passed down to their children, and like a virus of goodness running through the world. Your care is contagious. Thank you.
Thank you all. Happy Nurses Week. We're a little over time. Thank you so much for coming, and thank you for everyone on the phone. We have filmed this, and we will send links out, and it'll be archived for other people to view as well. Thank you.